Why do people who suffer from mental health difficulties such as depression and anxiety want to keep their symptoms a secret from the rest of the world? The topic of mental health is one that is frequently regarded as taboo, however, it is one that we need to begin discussing in a more open manner. However, when it comes to treating them, many of the diseases stay misdiagnosed due to the stigma that is linked to them. This is despite the fact that mental health problems are on the rise across the globe. People are more comfortable having conversations about their physical health, but when it comes to their mental health, they are more hesitant to do so because they are unsure of whether or not they will receive the necessary support on their journey. Dealing with mental diseases on one's own can exacerbate feelings of isolation and misery in a person. Here are mental health disorders that often go undiagnosed. Number 5. Bipolar disorder. The mental condition known as bipolar disorder, also referred to as manic depression, is characterized by sudden shifts in mood. Those who suffer from this condition experience alternating periods of depression and mania throughout their lifetime. While these people are going through a depressive episode, they may feel hopeless, empty, exhausted, or withdrawn. When they are going through a manic episode, they may feel exuberant or overexcited, and they may engage in risky behaviors. One research showed that patients with bipolar disorder are misdiagnosed 69% of the time, and 1/3 of these individuals continue to be misdiagnosed for a period of 10 years or longer. This is due to the fact that the majority of people seek therapy when they are depressed, and as a result, they satisfy the diagnostic criteria for depression. As a result, it is frequently misdiagnosed as depression. In a similar vein, some individuals seek treatment while they are still in a manic condition, and as a result, they are incorrectly diagnosed with ADHD. Number 4. Posttraumatic stress disorder. People who suffer from posttraumatic stress disorder are those who have been exposed to a traumatic incident, such as abuse or assault, neglect, disaster, or war. Among the symptoms are hypervigilance, irritability, flashbacks, trouble falling or staying asleep, social isolation, a decline in one's interest in or pleasure from normally enjoyable activities. 70% of adults in the United States will, at some point in their lives, go through a traumatic event, and up to 20% of those people will go on to acquire post-traumatic stress disorder. However, many of them are completely unaware of this fact. Like bipolar disorder, it is often neglected or misunderstood as another disorder. Symptoms look very much like other illnesses such as anxiety, depression, ADHD, and/or bipolar disorder. There is a widespread misunderstanding about what trauma actually entails, and the vast majority of the time, persons who have been diagnosed with different forms of mental illness typically have some type of PTSD that is driving their current symptoms. It is easy to overlook, particularly in situations in which the client or patient does not discuss the traumatic experiences from their past, or in which the psychiatrist or psychotherapist does not raise questions connected to the client or patient's previous traumatic experiences. We are of the opinion that PTSD affects a far greater percentage of people than is currently recognized, and that it may even be more prevalent than depression, anxiety, or bipolar disorder. Number 3. Borderline personality disorder. The primary symptom of borderline personality disorder is an inability to effectively manage one's feelings and emotions. People who suffer from borderline personality disorder may exhibit major mood symptoms or psychiatric symptoms, as well as serious behavioral symptoms, such as irritation or self-destructive behavior. Mood symptoms include things like rage, anxiety, and feelings of isolation, while psychological symptoms include things like a skewed view of oneself and narcissism. There are more than 4 million people in the United States who are living with this disorder. However, the condition is frequently not treated despite its prevalence. The vast majority of people who are affected by borderline personality disorder are unaware that their brains are wired differently, and as a result, they do not seek treatment. People with borderline personality disorder are able to hold down jobs, care for their families, and appear to lead very normal lives. They are frequently characterized as being overly emotional, expressive, or drama queens. Those who seek help for their mental health but are instead given a diagnosis of another ailment frequently have a difficult time getting the correct therapy for their borderline personality disorder. These erroneous diagnoses frequently include post-traumatic stress disorder, depression, or ADHD. Number 2. Depression. It is a widespread mental health illness that is frequently misunderstood, despite its prevalence. Feelings of melancholy, hopelessness, and worthlessness that persist over extended periods of time can all be indicators of depression. Alterations in a person's normal sleeping schedule, appetite, and level of energy are also possible for certain people. It is not abnormal to experience feelings of depression from time to time. However, when these feelings last for longer than 2 weeks, it may be an indication of a more serious problem. Depression that is not addressed might raise a person's likelihood of engaging in dangerous behaviors, such as becoming addicted to drugs or alcohol. Additionally, it can destroy relationships, lead to difficulties at work, and make it more challenging to recover from catastrophic illnesses. Clinical depression, usually referred to as serious depression, is a disorder that affects a person's health, mood, as well as their thoughts. The way you eat and sleep can be affected when you have clinical depression. It has an effect on how you feel about yourself as well as how you feel about the people around you. Even your thoughts are impacted by it. It is not enough for depressed individuals to simply get themselves together in order to get better. Untreated clinical depression can persist for weeks, months, or even years in the absence of appropriate treatment, which may include antidepressant medication and/or psychotherapy. The majority of depressed persons, however, can experience relief with the right treatment. There is growing evidence that people who suffer from clinical depression have a significant decline in their physical health. The most current research to investigate the relationship between health and serious depression focused on patients who had either coronary artery disease or stroke. The findings suggest that major depressive disorder patients who are also recuperating from cardiovascular events, such as strokes or heart attacks, have a more difficult time making decisions regarding their healthcare. They also find it more difficult to follow the advice that their doctor gives them and to deal with the difficulties that their condition poses. According to the findings of another study, individuals who suffered from serious depression had an increased risk of passing away in the weeks and months following a heart attack. Number 1. Anxiety. Anxiety is another common mental health problem that is frequently misdiagnosed. Anxiety can manifest itself in a variety of ways, including constant worry, complete avoidance of specific situations or activities, and bodily manifestations like as sweating and rapid heartbeats. Anxiety, just like depression, may range from light to severe, and if it is not treated, it can negatively impact every facet of a person's life. Disorders of anxiety are the most common kind of mental health conditions. According to figures provided by the Anxiety and Depression Association, more than 18% of the general population suffers from some form of anxiety illness. However, only 36% of persons who have the disease seek treatment for it. Many people don't seek treatment for their anxiety because they don't realize it's become a problem, which is one of the key reasons why there is still a stigma attached to mental health disorders. Another important factor is that people don't identify when their anxiety has become a problem. The impairment that a person feels is what differentiates normal anxiety from an anxiety disorder. Normal anxiety does not lead to impairment. It's possible that you have an anxiety disorder if your worries make it difficult for you to perform in social situations, at work, or in school. It's possible to get used to your anxiety to the point where it's hard to see how much of an impact it has on your life. This is because it's easy to become so accustomed to your anxiety. There are times when it is useful to take a step back and assess the kinds of accommodations you make to avoid worry or to think about the ways in which anxiety interferes with your day-to-day existence. Talk to your physician if you have any concerns that you may be suffering from an anxiety problem. Talk about the symptoms you're experiencing or the impact it's having on your life in general. What do you think of our video? Let me know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.